I call to order the interactive multi-stakeholder hearing as part of the preparatory process for the high-level meeting on antimicrobial resistance. I would like to extend a warm welcome to all of you. This meeting, held in accordance with Resolution 78/269 of 25th March 2024, has been organized with the support of the World Health Organization, the Food and Agriculture Organization, the United Nations Environment Programme, the World Organization for Animal Health, and other relevant partners as part of the preparatory process for the 2024 high-level meeting on AMR to be convened during the high-level week of the 79th session of the Assembly under the theme, Investing in the Present and Securing Our Future Together, Accelerating Multi-Sectoral Global, Regional, and National Actions to Address Antimicrobial Resistance. This multi-stakeholder hearing will provide an opportunity for stakeholders to contribute to the ongoing preparatory process for the high-level meeting. Participants will exchange views on key priorities for the high-level meeting and its political declaration, while exploring key challenges and potential solutions needed for effectively addressing AMR at the national, regional, and global levels. And now there will be a statement from the President. Ms. Amina Mohamed, Deputy Secretary General of the United Nations, Dr. Yukiko Nakatani, Assistant Director General of the World Health Organization, Ms. Vanessa Carter, Antimicrobial Resistance Survivor and Executive Director of the AMR Narrative, Excellencies, Delegates, ladies and gentlemen. It gives me great pleasure to welcome you all to this multi-stakeholder hearing on antimicrobial resistance in the presence of our hard-working Deputy Secretary General, whose extraordinary preoccupation with the spectrum of issues related to sustainable development has risen to such an extent as perhaps to be considered a calling. I extend my gratitude to the WHO, the Food and Agriculture Organization, the United Nations Environment Programme, and the World Organization for Animal Health for their support in organizing this important event. As we gather here today, a silent pandemic, antimicrobial resistance, AMR, accounts for nearly 5 million deaths annually. Left unaddressed, it is estimated that AMR could cause up to 10 million deaths per year by 2050. Moreover, if left unchecked, AMR will render the medicines we depend on to keep us safe and healthy practically ineffective. Despite the magnitude of its global impact as a pressing health challenge, it is concerning that currently AMR does not command either sufficient attention or awareness. It is therefore a public health necessity that we change this immediately, because tackling AMR is vital to achieving the 2030 Agenda for Sustainable Development, especially within the frameworks of universal health coverage, resilient health, environmental sustainability, and sustainable agri-food systems. Indeed, the implications of AMR cut across multiple SDGs. Our success in addressing AMR will therefore favorably influence our progress on all the SDGs, given their interlinkages. The upcoming high-level meeting on AMR, which is scheduled for 26 September 2024, offers a timely opportunity to mobilize much-needed political will and to bolster international cooperation in this looming threat to the public health and thus to the stability of society. I should like to commend the co-facilitators, their Excellencies Francois Jackman and Vanessa Frazier, the permanent representatives of Barbados and the Republic of Malta, respectively, for their notable dedication and leadership of the negotiations on the political declaration on AMR to be adopted in September. Excellencies, it cannot be overemphasized that AMR disproportionately affects developing countries. While these countries bear the brunt of its impacts, they also lack the financial resources and capacity to overcome them without support. What is needed to remedy this is a robust show of solidarity on the part of the international community through strengthened international cooperation, enhanced capacity building initiatives, and more importantly, demonstration of a strong commitment to the facilitation of technology transfer. Such a posture of solidarity and goodwill will support developing nations in their AMR response, strengthening sustainable health and agri-food systems, improving surveillance and monitoring, and enhancing environmental intervention such as waste and wastewater management, while at the same time promoting responsible antimicrobial use. As a strategic matter, we must also address the disproportionate burden of AMR on the most disproportionately affected, that is, women and girls. Not only do they often bear primary caregiving responsibilities, many also work in the agricultural sector with high exposure to pesticides and antimicrobials, and yet typically have less access to healthcare. Policymakers must therefore recognize and indeed address gendered differences in experiences and health outcomes. Accordingly, they should strive for inclusivity in decision-making and amplify efforts to provide equitable access to healthcare services, education, and economic opportunities for women. Dear friends, in closing, as preparations for the high-level meeting in September continue, we must remember that strong political will and leadership at the highest levels are indispensable in addressing the multidimensional challenges posed by AMR. I urge member states to integrate AMR considerations into their national SDG strategies and monitoring frameworks. Also, as a priority in national agendas, broader health, agri-food, environmental, and developmental policies and actions. Effectively addressing this issue demands the collective efforts of a diversity of stakeholders across sectors, many of whom are represented here today, involving civil society organizations, philanthropic foundations, academia, medical associations, the private sector, and also drawing from perspectives of women, youth, and indigenous communities. Our overarching goals must be to accelerate multi-sectoral actions at the global, regional, and national levels, building upon the commitments set forth in the 2016 Political Declaration on AMR. I am optimistic that today's discussions will delve into key policy areas and yield productive outcomes, guiding us to invest more effectively in our present while securing our future. In accordance with the relevant mandate, I will share a summary of this hearing with all member states and observers of the General Assembly prior to the high-level meeting. I trust that the summary will serve as a valuable resource for the upcoming high-level meeting discussions on the political declaration, ensuring actionable commitments in September that will help us control antimicrobial resistance. I thank you.